and I do appreciate that insight regarding all of the security issues that we are faced with. And I would just further that by saying that you've highlighted an area that I think shows just some of the hurdles and barriers that we're up against, which is that technology keeps building upon itself so quickly, and yet we're putting this on our physicians who are small business owners. And how can our physicians be able to incur that cost and stay up to date with the mandates of meaningful use as those evolve, the dollar signs. And I can speak to this on a personal level in our practice, having had IT for probably going on about 5 years now. Now, in order for us to be compatible with meaningful use, we're going to have to encounter about another $20,000. And that's for the meaningful use as it is applied now, and not considering the possibilities of changes in the future. So thank you, Dr. Baumer. I do have a couple of questions, and then I will be yielding to our ranking member. To Dr. Elliott, I know you have stated that you have not put into place your IT yet because of all of the costs that you know you're going to have to incur. One, being a podiatrist, what is the percentage of Medicare patients that you see? Or in relation to, I mean, I'm just going to, if you could say how many patients you see a week, and of that, if you have an idea of the percentage.
I see an average of 30 to 40 patients a day, 4 days a week. So 120 to 150 patients, and about 15% is Medicare. The majority of those Medicare patients are hospital-based patients, the patients with the end-stage renal disease, diabetics, that being called for wounds or amputations, things along that line, the more severe type of foot conditions.
So I guess the question is, and of course, I mean, this is completely your opinion, is it cost effective for you to incur the cost for health IT in relation to the possibility of future penalties that you may incur? You know, if we're, because as you've seen, as of 2015, it will increase and it will be sustained. Can your practice take on that penalty if you do not implement the IT?
My practice can, because it is a small percentage of my practice. So that 1% then becomes 2% and 3%, but it's only a 15% of my practice. So if I was going to do a cost analysis and I had to outlay all this money, for me it might be a better financial decision not to implement.
Not to implement it at all.
Correct. And my big fear is what my colleague here went through, where you do spend all this money and in the future things change and you have to start over again. I already have 11,000 patients. I have to convert all those records from paper to electronic. Now I have to go with a different company, and I have to convert again. Those are all costs that are involved once you convert from one system to another system, because it's not ready for the second phase, or has it gotten booted out or bought out by a bigger company. So
there again, the implementation and the changes in the technology world are really affecting us directly, because, you know, how can we comply with these issues? And that is one of our concerns, and I thank you for that. I will now yield to Ranking Member Richmond.